inside. I have to go inside.
Oh, that's fine.
Okay. So I have to go inside and I have to touch here. Does that make sense? So like you have to touch the skin. You don't have to look anything else. It's here. All right, so you're holding. All right, so for the hip, what are you gonna do? You're gonna hold and then you're gonna do abduction. Abduction, do you see? What is abduction? Like I'm pulling the from the body. All right, so I have to do adduction. So look me, this is in the center. Adduction is gonna be like this. You have to pass this, all right? So if you don't do it, it's not correct, all right? So this is what, okay, so, all right, so that's, you're gonna be doing abduction. You come here, adduction. Do you see it? All right, so then what I'm gonna do, I'm gonna do rotation. Do you see rotation? All right, so I'm doing rotation, and so because like my hands are on her skin, I can feel the crepitus if there is crepitus. All right, so I'm done. All right, now, don't go like from here, 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 like it's gonna be very confusing. Do one side, go to the other side. Is that clear? Okay, now I'm gonna do the right knee. All right, so bravo, okay. So the right, all right, so now, that's fine. Okay, so the right, so thank you for, because I have to touch the skin, otherwise it will mess the crepitus. All right, so now, this is the knee, all right, so okay, oh. All right, so what is this? Flexion. What is this? Extension. What is this? Flexion. What is this? Extension. Then I hold it like this, and I do rotation.
Do it multiple times?
Yeah, you can do multiple times.
But is it okay?
She's trying to get it stuck in her head.
Yeah,
Okay.
because
Yeah.
it's like you have to make sure that it's working,
Okay,
right? So
got it.
okay, so what is this? Flexion. What is this? Extension. What is this? Flexion. What is this? Extension. And I flex again. By this time I turn. Rotation. Do you see it? Okay. Now, when I'm gonna come to the foot, I need to have gloves. All right. So for that reason, you'll do all one side. Come to the foot. You do the other side, come to the foot, then you put the gloves, then you do the feet together. Is that clear? Because otherwise you're gonna be changing multiple times. So, but because like I did the upper extremity while she was standing, I could have done it when she was sitting. Does that make sense? All right, so now I'm gonna come here. Okay, and then I'm gonna, sorry, all right, so I'm holding, see here? Like you don't have to open the pants, but like you have to touch the skin. Is that clear? Okay, so like you're holding, it's a hold. All right, so what is this? Abduction. What is this? Adduction. Look look what I'm doing. When I'm doing adduction, I'm folding forward also. Okay, and then abduction, adduction. Then what am I doing? This rotation. Do you see? Rotation. All right, now you hold the knee now. Okay, so what is this? Flexion. What is this? Extension. What is this? Flexion. What is this? Extension, and then hold it. All right, so this is rotation. Rotation. Okay, now. All right, so I'm done. So if I wasn't doing the upper extremity while she was standing up, and like let's say she's on the table, okay, stand up, sit up, okay, so sit up, okay, so now see, like the patient is sitting and you're doing all the examination, like you're coming to the musculoskeletal. So what am I gonna say? All right, so we're gonna be starting, okay, Sophie, I'm gonna starting with your musculoskeletal system. I'm gonna be checking the joint of your face, which is the temporomandibular joint. Okay, so I want you to open your mouth, close your mouth, move the mouth right and left. So this way I can assess the joint movement. It was smooth. I didn't feel any crepitus, and then the patient didn't complain of any pain because otherwise she was going to grimace. So I'm done with this one. All right, so now I'm coming to the neck. And then for the neck, what am I going to do? I'm going to be checking the range of motion of the neck. So I'm going to be asking the patient to put the face on her shoulder, and then to put the face on the other shoulder, and then the chin on the shoulder, the chin on the other shoulder, chin on the chest, okay, and then straight. So what this was flexion, this is extension, and now I'm going to ask the patient to look up. Okay, so this is hyperextension. I'm going to help you rotate your neck, okay, so that you don't feel dizzy. Okay, so this is full range of motion of the neck. Do you see? All right, so like we're done with the neck. So what do I do? Okay, push, 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 push. What did I check? Muscle strength. Which muscle? The sternocleidomastoid muscle. What is the strength plus 5? Because she gave me the same amount of force. All right, so we're done with the muscle, like we're coming to the shoulder. In the shoulder, I'm going to be pushing, and she's shrugging her shoulder. The reason she is able to shrug the shoulder is because of cranial number 11, spinal accessory. And then because like she pushed against me, and then I put resistance, so I checked the muscle strength of trapezius muscle, which is plus 5. Okay, so we're done here, like we're here now. So I'm going to be assessing the joint now, the shoulder joint. Okay, I'm going to be asking the patient, put your hand above your head, and this is external rotation. All right, so put your hand around the small of your back, and this is the internal rotation. So this is, she did this active. So we're gonna do something passive here. I'm gonna be taking the shoulder, and I'm gonna be doing rotation. All right, so rotation. All right, so I did the rotation, and there is full range of motion. So I don't move now. I stay here, okay? So now what do? I go with the elbow, all right? So flexion, extension, rotation. All right, then I come down to the wrist. Okay, so this is extension, this is flexion, this is extension again, this is hyperextension, and I do rotation. All right, so now I come to the fingers. I'm going to be checking the muscle strength of the fingers. So I'm pushing, and she's trying to, I'm closing, she's opening, I'm closing, she's opening, I'm closing, she's opening, I'm closing, she's opening, I'm closing, she's opening. Meanwhile, I'm assessing the strength of her muscles of her fingers. Okay, now, Sophie, you're gonna lay down because we did the upper extremity, right? So now I'm gonna be checking your hip. I'm gonna be touching your hip. Is it okay? So if I go in, all right, so I'm just touching you. All right, so touch the hip. All right, so now what am I gonna do? I'm gonna do abduction, adduction. Look at me. Abduction, adduction. Then I'm gonna do rotation. All right, so now I'm gonna come to the knee. So what is the knee? So like I'm gonna do flexion, extension, flexion. You see, like I'm rocking too. Do you see? Like you have to rock too because to accommodate. And then I'm gonna do rotation. So I'm gonna come this side right now. Then I'm gonna leave the feet the last because I'm gonna be putting gloves. Then I do, once I have the gloves, I do the feet. All right, so I'm coming here. I'm gonna bother you again because I'm gonna ask you to stand up or sit up. All right. So because we're gonna be doing the shoulder. Okay, so with the shoulder, okay, so like let's do rotation of the shoulder because we did the external rotation and internal rotation. Then I'm gonna be doing the elbow flexion, extension, rotation. I'm coming to the wrist. This is extension. This is flexion. This is extension. This is hyperextension. This is rotation. Okay, so did we do the fingers of both?
Just that side.
Okay. All right. So what am I doing? Like I'm assessing the strength of the fingers. All right. So very good. So strong. She is resisting me. And now, like you can lay down again. You know what? Like we could have done this, the rotation while you're laying down too.
Yeah.
Right. I mean, you don't have to. Yeah, you can do it while she's laying down. All right. So, yeah. Okay. So like we're learning, like what is the most convenient way of doing it. All right. So I could have done it while you were laying down. You didn't have to sit up. All right. So for like young person, it's not a big deal laying down and then coming up. But like for an elderly, it's an issue, right? Okay. So. Okay, you hold it, and then so what am I doing? Abduction, adduction, abduction, adduction, and then rotation. All right, very good, rotation. And now I'm going to be bringing it here. And so what is this? All right, so this is flexion, extension, flexion, extension, flexion, rotation. Do you see? All right, we're done. Okay, so now, Sophie, we're done. Okay, so I'm going to be checking your feet. All right, so for the feet, I'm going to be wearing gloves. So I would kindly ask that you remove the. Okay, this is the time also when you're doing the range of motion, you check with your monofilament and then the monofilament. So get the monofilament and get a tuning fork. Yeah, somebody. Yeah, because we're going to check the vibration too. Oh my God, what's happening here?